welcome back. You're listening to Smooth, the 98.1. Love music, love life. It's 7:30 and it's time for Freshly Pressed 981. My name is Judith TV. Freshly Pressed 981 is our in-depth newspaper analysis show where we go in details. We find the details of the stories and we bring it to you live. And to do that today, I have with me our analyst, Lakunle, joins me live inside the studio. Lakunle, good morning.
Morning, Judith. Good morning, Lagos.
Lakunle is by himself. He's just pretty much his lonesome self. So it's just myself and Lakunle today. But you can join us, all right? So join the conversation. Send us a WhatsApp message to 0809 444 0981. Again, 0809 444 0981. You can also send us a WhatsApp message to 0809 444 0981. We're streaming live on YouTube. So go onto YouTube right now at Smooth 981 on YouTube. That's at Smooth 981 on YouTube. Let's get started, shall we? We're going to take the first story here, and it's coming from the Punch newspaper. Omicron, Canada bars Nigeria. Fear spreads as NCDC records 3 cases. Virologists on Wednesday expressed concern that there was a high risk of community transmission of Omicron variant of COVID-19 in the country. The virologists, including a professor of medical virology at the University of Maiduguri, Masili Baba, who stated this in a separate interviews with the Punch while reacting to detection of 3 cases of the Omicron variant in the country, called for community testing. The experts stated these as Canada placed travel bans on Nigeria, Egypt, and Malawi. The Nigeria Center for Disease Control had on Wednesday morning announced the discovery of 3 cases of the Omicron virus, variant of the coronaviruses. The NCDC's detection of 3 cases of the Omicron variant came 3 days after Canada said it had detected cases of the variant in 2 travelers who recently visited Nigeria. Doctor, luckily.
All right, so Omicron, this for the umpteenth time, another strain of the COVID-19 virus. Late, I think early last week, South Africa announced announced this variant. That was the first time it was hitting the news. And between then and end of the week, there have been a lot of back and forth between and within countries where it originated and all that. And everybody seemed to want to put the blame on South Africa, the Southern African region of Africa particularly, only for us to hear, I think as of 2 days ago, that it had even been discovered pretty much earlier in the month or late October in Netherlands. Okay, so the story as it affects us is this, that over the weekend, 2 Nigerians were tested positive for this variant in Canada, and it was widely reported. And just yesterday, the NCDC Director General, Dr. Adetifa, on TV confirmed that the strain is actually here, that they found people who have travel history to South Africa. And for whatever it is worth, the point for me is not to so much worry about where and how and all that. The point that we should note is that whatever strain of the coronavirus it is out there, it is deadly. Are we doing enough in terms of vaccination? Pretty much no. We've only done about 1% of our population to date. Somebody observed a few days ago and said quite a lot of people may have had this virus, went through it, the cycle of the virus in their systems, and they walk about and they say that they are tired, they have malaria, and we are pretty much lucky that the fatalities may not have been as the number of people that may have contracted the disease. So some of us may have been lucky in that way. We have not taken the vaccine. We may have contracted it. We may have survived it without even knowing that we actually contracted the virus. But what of those people who would not be that lucky? And this is where it comes back to the same thing, the appeal we make every time. Please find your way to the places, designated centers for vaccination. People get vaccinated. Even when you are vaccinated, please avoid enclosed and crowded places. Obey and follow all the protocols that government has announced. Wear a face mask, wash your hands, don't shake hands with people that you don't know. If you do, try to wash your hand as soon as possible. The numbers that everybody seems to be quoting about Africa seems like it is almost insignificant. People would argue, why are we worried about COVID? Malaria kills more people, cholera kills more people, so why is it COVID that is our problem? But the point is that let's assume that it is not our problem here. Don't let us carry what is not our problem here. Don't let us export it to other places. Every country is trying to keep their people safe. Let us also keep ourselves safe in Nigeria. Let us do the right things. Let us get vaccinated. The government has said that they will do what is humanly possible to make vaccines available. So the long and short of the story is the responsibility to stay alive is ours. Let us stay alive. Let us take the vaccine. Don't let us be bogged down by the politics or otherwise of the vaccine itself, of the vaccine or the virus. The most important thing is to stay healthy and stay alive.
Luckily, you were talking about pretty much just people who probably might even have the virus and don't know, that they have the virus, and me walking around and just having symptoms and saying that they have malaria. Don't you think that's to attest to the low testing that we currently have? And just maybe talk to us about that testing part, because the virologist talked about how communities need to amp up testing, for persons, because there might be widespread of community transmission.
The first thing before you get people to go and even do a test is to convince them that this thing exists, right? Now, let us assume those 3 cases that were found in Nigeria over the weekend, the people that have come in contact with them, have we been able to isolate such people? Where they have been? Have we been able to know those places? Those people in those places that they have been, the people that have come in contact with them, are they convinced in themselves in the first instance that this thing is real, that they need to go and get tested? Then it comes also to the point of the cost of the testing itself. Okay, so government says my test is free if you can prove that you've been exposed to somebody who has the virus. Now, if I just out of the random want to go and do a test, how many of us can put down the 50,000 naira thereabout to go and do a test 1 and a test 2? That's about 102,000 or thereabout. So the dynamics of the belief that the virus exists, the costs of taking the tests are the things that are playing out here. Okay, and that's why you hear people say it is malaria I have, and they will be treating themselves for malaria, and luckily pretty much they get about it. So we are under testing, we are under vaccinating. These are the 2 things that we need to get to ramp up. The testing, can we reduce the cost? Well, it's a matter of debate whether the cost of the tests can be reduced. Can we get vaccinated? Of course, we don't manufacture the vaccines here. We depend on others. There are a lot of dependencies on how much vaccines we can get, right? Now, even when we get the vaccines, the reluctance or the enthusiasm with which people will go and take the vaccine so that it doesn't get wasted is another issue to contend with. So all these things are the dynamics that are in this matter for us locally here in Nigeria that we are contending with.
Let's move on. Still on vaccination. This is from this day. Scores of workers shut out as federal government begins enforcement of vaccine mandate. Many returning federal civil servants on grade level 12 and below were barricaded from entering the federal secretariat on Wednesday for failure to present proof of vaccination against COVID-19. The commotion at the Secretariat followed the enforcement of a new vaccine mandate policy, which came into effect yesterday, Wednesday. Lakunle.
Well, this is typical of what we just spoke about. Okay, so we have grade level 12 officers and above. These are supposed to be the and below rather. So these are supposed to be the federal civil servants, and the government has let out a circular over 6-8 weeks ago that you are going to resume on so dates, but make sure that you get vaccinated before you come. If you are not vaccinated, you need to present a PCR test taken 72 hours before, which means every day you want to go to the office, you must take a PCR test 72 hours before, right? Now, yesterday was supposed to be the first day of resumption at work, and people who have not been vaccinated went there. See, this is a part of the things we just spoke about our convictions that this thing exists. It's not enough to say I don't have it. How about the next person to you in the crowd? Do you know whether the person has it? So the government's rule about coming back to work but be vaccinated or show a PCR test has given you the window to choose which one you want to do. The government needs to protect itself in terms of, like they say, prevention is better than cure. If you don't, if you leave it open that people should come, so one person comes and infects everybody in an office, for example, the cost of treating those people goes back to the government again. So is it cheaper for the government to give you the vaccines to prevent you from falling ill, or to allow you to fall ill then treat you? So from perspective of government, you can understand that. Now, the government has not said if you don't come to work, I have sacked you. It has only said if you want to come, do either of the two. So I think that people should just take an option. I want to go to work, I go and take a test, or I take the vaccine. I don't want to go to work, I'm still working at home. Do whatever you need to do. Let us obey these things, and let's have a safe environment.
All right, we have messages here. This is Timilein Idowu on YouTube here. It goes, luckily, the people infected with Omicron, have they not been vaccinated? Let's take issues reasonably, please. And it goes on to say, the focus should be obeying the guidelines. This is a maker from Amuwo. And it goes, people are blatantly refusing testing and vaccination. A man presented to our clinic with symptoms in keeping with COVID. I sent him to do a COVID test for which he is covered under health insurance, but he blatantly refused. That's a huge problem. This is Fabian from Ekpe. Good morning, Judith and Lakunle. Regarding the new variant, I would like to emphasize that South Africa detected the new strain because they were testing. The government needs to up its game with testing and ensure a more preventive and proactive stance. We move on now to Punch newspaper. This one, the headline reads, kidnappers are now considered terrorists, says Malami. The Minister of Justice and Attorney General of the Federation, Abubakar Malami San, has said kidnappers have also been declared as terrorists. He said the recent court declaration has been gazetted and would soon be published. He also disclosed that all the relevant security agencies had been notified. Malami made this known while appearing on Politics Today, a current affairs program on television, which, of course, correspondents were monitoring in Abuja on Wednesday. Lakunle, terrorist, finally? What took them so long?
So I'd rather look at it from this perspective that whatever name you call them, they are constituting a nuisance to our security, to our ability to feed ourselves, and health risks. For example, Zamfara is one of the states hit by cholera in a few weeks ago. It's one of the states that has the highest incidences of this. So even the response to go and even check out what is happening there is limited because people so I'd rather us not focus on the name calling. I'd rather us focus on what the issue really is. Security. What are we doing? We will call them terrorists. So does that solve the problem? the real issue here is, I think that we are focusing more on the politics of this issue than the real thing. Let us solve the problem itself. Let us get rid of these people whichever way we need to. People need to go back to their normal lives. These people have deprived people of their normal lives. They can't go to farm, they can't go to school, they cannot travel peacefully like they used to. So if we call them terrorists today, yes, it is fine. That's what they are, because they are using force, terror and terrorize and use force to
Terrorizing
people
travelers
and
and
all
just
that. Yes,
causing trauma
but
to families.
but that, for me, that is not important with respect to the root cause, which is getting rid of it in its entirety. The minister has finally succumbed to, or the government has finally succumbed to people's pressure. Okay, now they are terrorists. What is the next step? That's where I think that we should focus more on.
So syntax is not it. Let's move on to Daily Times. Insecurity, FCTA to establish agro-ranger stations in farming communities as part of measures to curb insecurity in the nation's capital. The Federal Capital Territory Administration, FCTA, has disclosed plans to establish agro-ranger-based stations in the farming communities within the territory. The Director, Admin and Finance Security Services Department, FCTA, Mr. Abdul Latif Bello, gave the hint during a press briefing in Abuja. Bello said that the initiative will help the farming communities return back to farm to ensure abundant and affordable food and agricultural products in the FCT. Luckily.
Okay, so this agro ranger group, do they already exist and they don't have offices before, or they have offices in the city center and they don't have in those places before now, and they are going to do, or they're just setting up the group entirely from the scratch? This is a perspective to look at this from. Okay, so when you set it up, what is their job? Is it that they are going to be the first level of resistance to the bandits, the terrorists when they come, or they are just to observe and report back to a security agency who is going to then come, or what? Now he's talking about perimeter fencing for schools, CCTV cameras for places, people to report when they see things happening around them. Okay, all these are good. Okay, so CCTV camera, how extensive is it going to be to reach those places? Where is the power that is going to make the CCTV camera work? This group you are setting up stations for, what equipment are you giving them to make their job effective in doing this? If they're going to be the first level of resistance, or if they're just going to observe, who are they calling? As so the it's not just enough to just say we will be doing something. What is on ground? I think we're speaking too much about this security issue that is affecting us in this country. We speak too much about it, we are doing little about solving it from where I see it. Everybody wants to be seen to be doing something, and it is belittling the sacrifices the people who are actually on the field are doing to solve this problem. So in closing on this, I think that maybe the FCT has been lucky. They've not had the issues that other states around them have had. Every day we have what happens in Niger State. Niger State is just next door to the FCT, as it were. And maybe whatever it is that they need to do anyway to get this solved, I wouldn't know what they would say, what they would do, but talking to us about it, security is even much more about those things that we don't see and hear, much more than those things we hear and see. So I think that they should focus the energy on doing those things without telling us, so that people should just have a feeling that they are secured.
Wonderful stuff. We have messages here. This is Bosun from Suliri. Goes, good morning, Smooth. I have a concern on COVID vaccination. I took the first dose of AstraZeneca, but when I went back for the second dose, I was told that they only have Moderna, and no one at the center could educate me. Can I take the new dose considering I took a different different one earlier. I believe this is one of the reasons why we have such a huge difference between the first and second dose recipients. Okay, so I took AstraZeneca, and I didn't. I took both my first and second was AstraZeneca, so I don't know about the Moderna, but I've seen reports that have said that a mix matching sort of like boosts immunity. That makes any sense. Potent immunity, but I'll find out. But I'm sure that if the centers are giving out the Moderna, they are the health officials, and of course they're the best persons to ask. So if they didn't educate you, why don't ask them when you get there? So to everyone out there, when you go to the centers, make sure to ask questions. Oh, what is it going to be? And I know that sometimes the WHO officials go there to inspect, so you might want to ask them as well, just to be on the safe side. This is Idima Puza from Surulere, and it goes, now that the case against Soludo has been disqualified, there's no need, we're not, now we're going to come to that later. This is Fred from Festac. It goes, good morning, crew. We are just playing to the gallery to find favor before the West for obvious reasons. If the world is having a COVID-19 problem, we're having a cholera and malaria problem. Why should all our attention be on COVID and not our issues? Now they are violating the rights of the citizens with compulsory vaccination. Which is better? Which is better? Is it to fight the main issue here, or focus all our attention to COVID? Is it COVID that is our problem, or cholera? Ms. Alakunle, when you say a government has not sacked people, if they did not come to work, will they be paid? Should I answer this question, or do you want to answer the question?
The government didn't say that if you don't come to work, I won't pay you either. And they didn't say if you don't come, you are sacked. They have only said if you have not been vaccinated, don't come. Don't let us preempt what these things are. As at this month, because of what I know that, as at last month rather, because of what I know that no civil servant in the federal service was denied a salary for not coming to work because of the lockdown or the work from home regime.
And also, Fred, if you're thinking that COVID-19 is not a problem or not our problem, then you clearly are not reading the news, because Canada just barred Nigeria from going into that country. And that means trade and everything else in between. And that would affect our economy, imports and exports. Take that as a note.
Stray bullets.
Let's move on, shall we, to Premium Times. Reps ask IGP to dismantle all illegal checkpoints following fatal accident. The House of Representatives on Wednesday called on the Inspector General of Police, Usman Akali, to dismantle all illegal and unnecessary checkpoints in the country. This resolution was a sequel to a motion of urgent public importance moved by Ifeanyi Muma on the need to investigate the death of 20 persons along the Owerri-Onitsha Road in Hiala area of Anambra State. Now, according to Mr. Muma, on Sunday, a trailer laden with goods rammed into vehicles at the checkpoint, killing 20 persons. Luckily.
Sometimes the stories about death in Nigeria are so unbelievable and are so pathetic to hear. Most times they are needless and unnecessary. This is an example of such innocent people going by, and then at a checkpoint, a trailer comes, couldn't control itself, rams into one vehicle, and 20 people are dead just like that. I can't recall in my memory any time that we've had a new IGP and dismantling all roadblocks had not been one of the whatever points agenda the IGP has. And the very day that statement hits the news, you go about, you see checkpoints all over the place. They don't even just stand by the road. They put all sorts of objects on the road, drums, some even light fires, and then the road
and tires as well.
Exactly, and the road, which is made with bitumen, burns up and gets spoiled, and that's how that road at that point starts getting bad, and it goes on to expand and spoils the rest of the road. You know, I had reason to be somewhere in Osun State over the weekend. The number of checkpoints between Ibadan and Bongon Junction, I lost count after I counted 3. After I counted about 5, I think I stopped counting. You know, and each point people, because they wanted to avoid them, the Ibadan Ife Expressway, most of those public transport drivers, because they want to avoid them, they will switch over to the other lane, the ones facing Ibadan, to avoid them. So they will switch to the other side, drive on that side facing oncoming traffic. Another risk they have got, because they wanted to avoid the unnecessary bottleneck that the checkpoints have caused. Okay, so this happens all over the place, every day, every time. And what does it cost? And then when you ask, the thing you hear is that they are providing security. I would rather have these policemen in their trucks, their cars, and be patrolling and moving up and down the road than stay in one location. It's easier for them to provide security when you have 2, 3, 4 squads patrolling a stretch of road than one squad or 10 squads staying at designated spots. I mean, what happens in between the two spots where they are staying when anything happens? So I think that I am one of those people who believe that there is no need for us to have, even within towns, those are okay. The one we are describing is interstates. Within cities, within towns, you see it every day. You just come out in the evening, you see them standing on the road and are blocking the road and are causing unnecessary traffic. So I hope that this debate and the resolution by the House will be effective, and they can compel the IG and the commissioners of police of all the 36 states and the Federal Capital Territory to enforce this directive, that they should please take these things off the road rather than them staying in one location. They should fund, and most of them have enough patrol vehicles to do the movements up and down. That is even more a better way to secure the roads than to be stationary in one place.
Let's move on to still from Premium Times. Cholera has killed more Nigerians than COVID-19 in 2021, NCDC. The Nigeria Center for Disease Control, NCDC, has said cholera has claimed more lives in Nigeria than the dreaded coronavirus pandemic, especially in 2021. The Center's Director General Ifedayo Adetifa said the country has recorded a little more than 3,600 deaths from cholera in the last 11 months, while the total fatalities recorded from coronavirus since 2020, when the index case was recorded, still stands at 2,977. Now, he was a guest on a morning program where he gave this update on the Omicron COVID-19 variant found in Nigeria. I have my thoughts about the story, but luckily, you go first.
So if this comes from Dr. Adetifa, it cannot be anything but the gospel truth. But how do we how do we digest that information is what the issue is for me. So it's one way, it tells us that we have possibly a bigger problem with cholera. Like, for example, Zamfara has a high prevalence of cholera. It's one of the 5 states where the thing has been prevalent over the last few months. Yeah. So add that to the securities they have. So it means that if they can't get to health centers to get treated, that means more people will die from that in that place. So, but how do we process that information? It strengthens the argument of people that says that COVID is not our problem, like somebody just sent in to us now that we have bigger problems. But here we are. Cholera is something that has been with us for ages. Every year, it seems to me like it's seasonal. We know the source of where people contract cholera.
Contaminated
water,
hygiene,
personal good and bad, poor personal hygiene, and all that. What can we do in that regard to sensitize people? Would it cost us as much as anything else if we do sensitization on these matters of and government, and we provide clean potable water for people to access to clean and potable water for people? So this is the issue for me, that while we're saying that cholera is out there, it's killing people. Also in that report, don't forget, the DG said something about the NCDC preparing for the meningitis season. That is prevalent during the dry season when the heat is particularly very high. So that's another problem on its own. If you look at the numbers that that he quoted, he said cholera has killed a little over 3,600 between January and now, but COVID has killed a little under 3,000 since 2020. So that means that if we do a proration over a 2-year period, we could assume to say that cholera has killed twice the number of people that has died of COVID in Nigeria, right? So like I said, it is a matter of how do we digest the information. But it does not mean that one is a lesser problem. It just means that there are two big problems and we need to solve the two of them.
But I mean, if one was to look at the number of the fact that the testing is still very low when it comes to Nigeria, and there are most cases, especially in the lower middle class and low income communities and states that don't have access to testing, won't you like query that figure to say that there's some who have died and gone untested?
Would have to work with the numbers that we know, so that we don't create a big elephant in the room. Let's work with the numbers that we know. We can only work with numbers that's been reported. Equally, the same thing will also go for cholera. Many would have died that are undocumented as well. So I'd rather see it from the perspective of we have two big problems on our hands, and we need to deal with the two of them at the same time.
All right. That brings us to the very end of Freshly Pressed 981. Lakunle has been my guest here, my guest analyst inside the studio. Go follow him on Instagram. He's at Lakunle70. Again, at Lakunle70. Join us at 8:10 a.m. for Lagos Talks 981. That's where we open up the telephone line for you to react to the stories that we took inside of Freshly Pressed 981. My name is Judith TB. Good morning.
The headlines, the stories, the news.
Headlines. Read all about it.
In-depth analysis of national current affairs. Freshly pressed on Smooth 98.1.